The slums of Africa are the breeding grounds for HIV.
Almost 4 million South Africans are HIV positive.
The epidemic has spread throughout the region.
The 1990s for sub-Saharan Africa was an HIV epidemic without any solution. It really continued to be the worst disaster that could have happened from a public health point of view.
HIV was largely something to be feared, something that people didn't really understand well. It was also seen as a death sentence. There was no treatment.
Everywhere you looked, people were dying of AIDS throughout Africa. Funeral upon funeral upon funeral. Without antiretrovirals, the epidemic was an unrelenting cascade towards death. There was an extraordinary turning point in 2000, and it was really about breaking the silence.
We are normal. We are human beings.
You can't treat an infectious disease epidemic without drugs. And that recognition was the turning point, followed very quickly by recognition from governments and agencies that this needed to be globally tackled. We saw the formation of the Global Fund, the President's Emergency Fund, PEPFAR.
Seldom has history offered a greater opportunity to do so much for so many.
The drugs became available and they became affordable. These were the things that made a huge difference.
Reflecting back to the late 90s, early 2000s, and today, it's almost like night and day in some ways. For example, the difference between 2012 and 2016, we had an almost 40% reduction of AIDS-related deaths in Kenya. Our numbers of new infections reduced by about 30%. Right now, an HIV diagnosis gets you onto a path that allows you to access antiretroviral therapy that enhance quality of life.
We now have some very exciting prevention tools that are in our toolbox that need to be deployed. All of this is going to require ongoing funding, both domestic and international.
If we do not continue to invest so that we can lower the number of new infections significantly to less than 18,000 per year in a country such as Kenya, the reality is we'll have a resurgence of HIV. After all the investments we have made, we really can't afford to do that as a global community.